We are a speech practice with 9 locations across Long Island. We treat a variety of ages, disorders, and disabilities. We are comprised of over 50 plus highly trained speech language pathologists that specialize in treating the different disorders and disabilities that enter our offices. These trainings happen both inside and outside of our therapy locations. Our speech pathologists are all trained in prompt therapy and myofunctional therapy, as well as feeding therapy. They work with individuals with language and processing issues, whether they be developmental or acquired, such as with an adult who had a stroke or TBI. We work with auditory processing, patients that have stutter and fluency issues, voice disorders. We've worked with commentators, transgender individuals who need to work towards changing their pitch and intonation. We work with little kids who are acquiring language and may be delayed in their language. Augmentative communication, so teaching children sign language or how to use a different form of communication. And then just the simple things like articulation, improving someone's overall quality and intelligibility of their speech. One of the things I am most proud of is our trademarked myofunctional therapy program, known as spot therapy, that is only available to our patients through the trainings of our clinicians within our office. The true benefit of myofunctional therapy is to work on the deficits from their core and not just work on treating the symptoms. Long-term results can change anything from issues with sleeping, braces and retainers, being able to articulate better, chew and swallow and eat a variety of textures and consistencies, issues with sucking their fingers and their thumb, sucking on their tongue or biting their nails, improving their overall smile and their bite. Myofunctional therapy can actually help patients that have temporomandibular joint disorders. I think what makes us different from everybody else is that all of our therapists have to be well-versed in every area of speech-language pathology.
I think Skylar probably was a little self-conscious of her speech in the beginning. I've definitely seen a change in her. I always love the feedback that we get like instantaneously. Like as soon as her session is over, the instructor will come to me and we'll work on something. No matter what teacher Skylar has had, it's a smile, it's encouragement. They go above and beyond to try and make sure that they give him every possible opportunity to succeed, and I've never once had a bad experience.
So many times the parent is hearing what I'm saying for the first time, and it's, that parental gut instinct that they have been feeling this whole time and no other professionals have really told them, and it just makes sense to them. We are oftentimes the professional that is communicating to all other providers on our one patient. We're reaching out to the ENT and to the orthodontist and to the oral surgeon, making sure we are all on this patient's plan of care and making sure that we are going to be able to get those optimal results that we want for that patient.
The sooner we can intervene, the less, we always say, that habit has been ingrained, so the shorter time it takes to break that habit.
Our experience here has been a wonderful experience. We've seen great progress with her speech, with her enunciation, even with her feeding habits, which had been a big issue. As a mom, I was very happy to see her gain confidence in the classroom and participating in class more often.
When I started LI Speech, I wanted to create a standard, and a high standard for our speech pathologists and their skill set and their level of knowledge. As we grow, we are able to have a larger impact on the community, and even more so, we continue to evolve our field of speech-language pathology. When I walk through the office, I'm so proud of what we do here. We're impacting the lives of so many outside of this office. You always want to know that you're making a difference. There's nothing better than that.